Hi, folks, and welcome back to the program. Well, according to that 7-day forecast, looks like we might have some, flurries coming our way. But hey, we're sturdy people. We're used to that, especially after this winter. Time for a Great Look Monday segment. We welcome Dr. Sam Shatkin from the Aesthetic Associates Center on Kensington Avenue in Snyder with us this morning. Dr. Sam, it's good to see you again.
Great to be back.
Really is. You brought one of your patients with you this morning?
Well, John volunteered to come on the air with us.
John McCrecker. Right. Nice to have you with us, John.
And John is a patient of mine, and he's excited about how he looks and feels, and he wanted to be on the air with us.
You want to tell us what John had done?
Well, yeah, in 2009, John had a facelift and eyelid lift as well. And from those areas that we did, we make our incisions around the ear, and if you can even zoom in closely, it's very imperceptible, the scar. And especially on men, because they can't wear their hair down like the women can, that's always a big concern. But his scars look nice, and we basically lifted his skin, and we actually have a before and after picture to show you the difference.
Well, you're saying his scars look nice. I'm trying. Wait a minute. I'm still trying to find them. I mean, that's amazing.
Yeah, the scars look
amazing.
Well, you know, plastic surgeons are always concerned about, obviously the aesthetics and the scars. So here's the before. Actually, this is the before picture, and you can see the after in plain sight here. But here's his after picture, where you can see a tightening of the jawline, lifting of the areas around the mouth, softening. The eyes look more refreshed. And maybe John can tell you how he feels about that.
Yeah, John, let's hear your thoughts.
It gives me a sense of well-being, and at the same time, I want to age gracefully. Okay, gracefully.
Right.
And a number of my colleagues, people at work, or my friends have said, wow, what a difference. What a difference.
It doesn't look his age.
Has anyone actually put a volume of years on you, how much younger you look?
Yes.
10, 15, 20, what?
I've had people age me between 43 to 54.
How old are you, John?
I'm going on 62.
Wow.
Looking good.
Isn't that?
Well, there's what we were going to do today for John is we're going to tweak it a little bit, okay?
Oh, we're actually going to do this right
I'd like to do that now. He came in and said, you know what, I'm a little bit bothered by this here. Everything else he's really happy with, but as time goes on in gravity, it's been a couple years. So we're going to do a little filler right into these two spots here. So if I can go ahead and do that now, and it just takes a couple seconds. I've pre-mixed the material. And turn your head this way, John, for me. What I'm going to do basically is I'm going to mark the area that we want to put the injections.
Okay.
And John and I talked about this ahead of time, so
this is not a laundry marker, folks. This will come off.
Yeah, it doesn't last forever. And then
I was telling the doctor this is the first time I believe he and I have been together.
In the white coat.
Wearing the white coat.
You don't get nervous around doctors.
I started to get a little nervous, doctor. I really did. But
I don't know.
When I saw you brought John, I felt better.
Okay. Well, here's the syringe, and I pre-mixed it. We mixed a little local anesthetic right into the syringe.
Oh, okay.
And for those of you that don't like looking at needles, there's no blood here. But if you don't like looking at needles, turn the other way for just a moment.
Sure.
But it's going to be pretty simple for John. What I do is I just cleanse the area with alcohol.
Okay.
And then I take our needle on there.
Right.
And I inject it. And I sort of have planned as to how much I'm going to do. The material is white. I go right down to the area where the bone is.
Okay.
And I'll put that needle in there. And John feels very minimal. Tell us, do you feel anything, John?
No.
How do you feel?
Like let folks know we might have time for a couple of quick calls. 644-9840.
Okay.
If you would like to call.
And then
this is really a TV first for me, at least on the program, having a procedure like this done live. This is great. And John, you're a trooper.
All right, now I think when I wipe this off, I think right away you can see the difference on the right side compared to the left. We haven't done the left yet. I'm going to do that in just a minute because you can see how easy it is. Look towards the camera, John. And now see, this one's a little flat in here where the marks are, and this is rounded, and it's a little softer look.
There we go.
Can you see that? I mean, I think it's pretty easy. See right here how it's a little bit down there, and here it's built up. So John, turn towards me, and we'll do the other side.
Now you put two dots there. Are you going in twice?
I'm going in twice. You can watch right here. It's this simple.
Doctor, the stuff you're putting in, the filler you're putting in, is it a permanent thing, or does it
go unfortunately,
away? Have to do it again?
Right. This material is called Radius. And the manufacturer and the FDA has it approved, and they say it lasts about a year. a little bit more
right.
than a year.
Okay.
So he'll come back, and usually the patient will come back around 6 to 9 months and say, can you put a little bit more in? But usually we don't have to put quite as much in there now.
Yeah.
Look back towards the camera now. So we've done those. We've done those 2 areas. You see, it took nothing more than a few moments to do, and he's looking better.
You're a Michelangelo.
Well, I don't know about that. I can't. I'm nowhere near what Michelangelo's skills are, but some of the things that we learned from Michelangelo and the artists about facial proportions and alignment and things we can share with our expertise in plastic surgery. And as a board-certified plastic surgeon, I feel very competent and comfortable doing these things.
John, can I ask you a question? Go back to your initial surgery. What was the recuperation like, and about how long was it before you could assume normal activities?
Okay, since I had the facelift, the initial facelift done in March of 2009.
Right.
I was initially scheduled for January of 2009, but
Interesting story here.
Yeah.
okay. But Dr. Shatkin and his staff did their EKG, and there were some abnormalities. So I had to have those abnormalities taken care of.
All right.
And they were, and then I was finally given the okay to
Have it done.
You know, this is an interesting story that John brought up, because a lot of patients always ask us, you know, what about the safety in an ambulatory surgery center? You know, we do our surgery at our office.
Sure.
When John arrived that day, we did an EKG on him and noticed that his heart rhythm was irregular. And right away, myself and our board-certified anesthesiologist did a rhythm on him and realized that. So we postponed the surgery, sent him to a cardiologist. He got it all checked out. And then a couple months later, from January till March, then we went ahead and did the surgery.
That's good to know. You're very careful.
Well, we're a fully accredited ambulatory surgery center, just like a hospital would be accredited. So.
But I was unprepared for that story. What I'm talking about is after the initial operation, did you have to convalesce? I mean, could you go right back to work? Did you need a week off?
It takes about a week to 10 days.
A week to 10 days.
But the main thing for me is always to follow the doctor's instructions.
Oh, of course.
The ice packs on,
Yeah.
at all times. Usually don't go out for the first couple days.
Well, sure, that's understandable.
But I responded very well to the recovery phase.
Well, that's wonderful. Yeah. And doctor, before we run out of time, you have some products.
Well, I just want to say, you know, it is Valentine's Day coming up really soon next weekend, and I just want to tell everybody that all of our products, all of our fillers, the same thing you saw today on the show, and Botox is 20% off. Okay. And we have a website that has our products on the website as well. Okay. You can go to our site and get some of that information, and everything's 20% off. Not the surgery, but the non-surgical, all the non-surgical treatment at 20%.
All right, doctor, thank you so much.
And we do have the 2 offices, John. We have one in East Aurora, 268 Main Street in East Aurora, which I know you did a live.
I loved it. Yeah, that was great.
And then we have the one in Amherst.
John, thank you. You're a trooper. Thanks for putting pardon the pun, putting a face on this segment for us. All right, folks, take a look at the screen on how to get in touch with the Aesthetic Associate Center in either one of their locations, and call Dr. Sam and get ready to look your best.